Good evening, everyone. Did you know that there were 3.4 million diabetes-related deaths in 2024? Yes, you heard that correctly. 3.4 million. Diabetes impacts more than 38 million Americans, with 9 million more undiagnosed. Today, I will be discussing the types of diabetes, their symptoms and side effects, and how to manage and/or prevent diabetes. Diabetes is broadly categorized into 3 different types. These include type 1, type 2, and gestational diabetes. There are also more, but these are the 3 main ones that I will be covering today. Type 1 diabetes is an autoimmune disease where the immune system mistakenly attacks the insulin-producing cells in the pancreas. The exact cause of this type is still unknown. About 10% of all people with diabetes have type 1, and while most cases appear in children and young adults, it can happen at any age. The next type and the most common type is type 2 diabetes. This type happens when your body isn't managing insulin properly and in certain cases is not producing enough of it, which causes sugar to accumulate in your blood. Type 2 diabetes can occur at any age, but is most prevalent in adults. Finally, gestational diabetes is a type of diabetes that develops while pregnant. It is triggered when the body is unable to produce sufficient insulin to regulate blood sugar levels during pregnancy. Most of the time, it disappears once the baby is born, but it can lead to the mother to later develop type 2 diabetes. So now I'm going to talk to you about the things you should be concerned about so that you are aware if you are ever to get diabetes. In an article on type 1 diabetes published by the Mayo Clinic, we learned that some of the symptoms are excessive thirst, frequent urination, bedwetting in children who have never wet the bed before at night, profound hunger, weight loss without trying, irritability, or any other mood changes, fatigue and weakness, and blurred vision. There are many symptoms with type 2 diabetes that are a lot of the same signs as type 1, but there are also some that are different, including slow healing sores, frequent infections, numbness or tingling in the hands or feet, and dark skin, generally in the armpits and or neck area. The Mayo Clinic also explains that there aren't many obvious symptoms of gestational diabetes besides thirst and excess urination. There aren't many overt signs to look for, but that is not the only side effects that they might do to your baby. I'll discuss these other side effects further in my next point. Type 1 diabetes is not preventable but can be managed. Type 1 diabetes can be easily controlled by taking insulin every day, checking blood sugar consistently, counting carbohydrates, eating balanced meals, and being physically active. People also watch for low or high sugar and treat it promptly. Routine checkups with a healthcare professional serve to keep things under control. Type 2 diabetes, on the other hand, is often preventable. You should be physically active, eat healthy and balanced meals, manage your stress, and take care of your overall health to achieve this goal. Finally, gestational diabetes cannot always be prevented, but by taking care of your overall health, as well as doing many of the same things listed above for type 2 diabetes, you can lower the risk of having it as well. If you do not manage gestational diabetes like you are supposed to, your baby could be at risk for a high birth weight, an early birth, trouble breathing from respiratory distress syndrome, hypoglycemia, which is low blood sugar, obesity and type 2 diabetes later in life, and if gestational diabetes is not treated and controlled correctly, it could even result in a stillborn birth of the baby. As we have seen, diabetes is a very life-altering condition. We discussed the 3 distinct types of diabetes, the symptoms and side effects of them, and we even talked about ways to manage and prevent them. It is definitely not something to be played around with. We do not think it will ever happen to us until it actually does. And I hope that the statistics I gave to you at the beginning of this really opened your eyes to that. As you move forward, I encourage you to take care of yourself, check on your health, and take these precautions to lower the risk of diabetes in your life.